Hello friends, I am Dr. Jeevan Pillai. I am a head of department at Metro Heart Institute and associated hospitals at Sector 12, Noida. Today I will be talking about the myths associated with coronary artery bypass surgery and life after it. The first coronary artery bypass surgery was done in India by Dr. K.M. Cherian in 1975. That was 13 years after the first coronary surgery was done in the world. In the 90s, 10,000 coronary surgeries were being done annually, but now almost 60,000 are being done annually. Presently, the indications for coronary bypass are severe diffuse triple vessel disease, left main coronary artery disease, and failed angioplasties and in-stent restenosis.
Doctor, what is the common myths related to bypass surgery?
The first myth that is associated with cardiac surgery is that I will die during or after the procedure. This is a great myth that is circulated all over the world. Nowadays, we are performing coronary bypasses at routine risks of 1 to 2%. If there are certain comorbidities, the risk may increase to 4 to 5%, not more than that.
Doctor, does the patient needs long rest after surgery?
The person is not supposed to rest and is supposed to get back to work as soon as possible. We encourage the patient to get up and ambulate in 48 hours or so after the procedure, and he can very easily go back to work in 2 to 3 weeks' time.
Doctor, is there any restrictions on activities after cardiac surgery?
The only restriction that happens after surgery is associated with sternal healing. Once the sternal healing takes place in 2 to 3 weeks' time, there is absolutely no restriction that is required.
Doctor, are there any restrictions on diet after cardiac surgery?
Dietary restrictions for patients who have undergone coronary bypass with no comorbidities like diabetes or hypertension is simply avoid or less of oils and fatty ghee. Rest is all the dietary restrictions are associated with the management of diabetes and blood pressure.
Doctor, how is life after cardiac surgery?
Life after bypass can be as routine as possible. Our former Prime Minister, Mr. Manmohan Singh, had triple bypass. So you can just imagine how the life can be absolutely normal after bypass. Clinton had undergone bypass. So any person who thinks that life after bypass is restricted or disabled is actually wrong. The person can have absolutely normal life, what he was having before chest pain and heart attack.
Doctor, many people are worried about the scar after cardiac surgery. How would they take care of these scar?
Scar is definitely a problem. You need to take good care of your wound in the initial post-operative period. Keep yourself hygienic, take regular baths, take care of the wound and dressings, apply corset, sternal corset, and if there is hypertrophic scar, then we need to show it to a plastic surgeon or a dermatologist.
Doctor, there is something called cardiac rehabilitation. What is the aim of cardiac rehabilitation?
Cardiac rehabilitation is encouraging the patient to get back to routine work. That again, I have spoken about the myth that person can't get back to work. Cardiac rehabilitation involves getting back to his feet and getting back to routine work. If the person is diabetic, the person needs to have a proper glycemic control and needs to have regular contact with his physician and keep his HbA1c as close to 6 as possible. So apart from diabetics, the person needs to stop smoking and tobacco consumption. He needs to keep the alcohol low. Low-fat vegetarian diet needs to be followed. Now, the importance of exercises can't be negated. Exercises will help in getting back to your pre-surgery exercise tolerance, your better glycemic control, and better control of cholesterol. Then there is also the importance of yoga. In the post-operative period, patients have excessive amount of anxiety. Now, anxiety doesn't help because it causes increased heart rate, and increased heart rate is not good for the hemodynamics. Person needs to undergo Shavasana is a very important tool which relaxes the mind and the body and helps keep the heart rate down. Yastikasana also causes stretching of the limbs and hence increases the blood supply to the heart. Pranayam is very popular among the population, a lot of people, but that is not encouraged after surgery. But having said that, once the chest, the sternum is fully healed, We generally have no restrictions on yoga. Any yogic postures, any yogic exercise can be done. The purpose of my talk is to allay the fears associated with coronary bypass. Coronary bypass is one of the best procedures that human mankind has invented. I see a great future of coronary bypass with smaller incision, with persons getting back to work sooner and contributing to the society. I personally have operated on so many patients who have gone back and served in police department, various other government institutions, and have contributed to the society for so long. Even the head of state of our country has served as Prime Minister for 10 years without majority of the people getting to know that he has undergone triple bypass. So the myths associated with coronary bypass needs to be negated. Go ahead with confidence, undergo bypass and live very productive and fruitful life. Thank you.